one of the first like wow moments of that course was when I cut the fascia on the posterior thigh.
Mm-hmm.
And when the leg is intact, you know, you have like the fucking adductors and you have 3 hamstrings and everything is like pretty much running in one direction.
Mm-hmm.
But when you cut that fascia, it just goes.
Yeah, it just falls apart, right?
Just drops.
Yeah.
Right? And when it just freely drops and it's not being supported by anything, a couple of the hamstrings went this way, a couple went this way, and then the adductors were all over the place. And it's like, so there were 2 real takeaway points for me on that. It was number one, it was like, okay, fascia is very much involved in the organization and the structural continuity of the tissue.
Yeah.
But then in the second one is that all of the different angulations of the muscles of the thigh require you to have different angles of bones to optimize those muscles.
Mm-hmm.
So then you go from the different angles of the hip and the thigh to the internal external rotation of the lower leg to the rotation of the foot. And it was like in that moment, and this is a elementary point, but it was like in that moment I was like, we can't train with the same foot pattern.
Yeah.
All the time. We can't.
Yeah.
You
need
have
variability.
to deviate.
Yep.
Because deviation of the foot changes the kinematic sequencing of the leg,
mm-hmm.
which is now evident in every program that I write.
Yep.
Right? So like that, the spiraling and like the helical nature of things is something that it goes back to what we were just talking about with like the lever systems and the torsion of the Achilles, where we just have a very reductionist view of the biomechanics and the anatomy because we're so obsessive about simplification and like minimum level understanding
mm-hmm.
that it like not only are people gun shy when you start having some of those different conversations, but it's also like I think that a lot of the credentialing bodies and a lot of the curriculum and the academia side of things doesn't want to have to complicate their process, so they continue to reinforce the simplicity models.
Yeah.
And I get it. Like we were saying, like I get it. We need to have a base understanding, and there are people that are going to pursue exercise science and kinesiology and all these things, and then just, you know, be very good personal trainers and be, you know, very good strength coaches that never really tap into the next level stuff, and that's perfectly fine.
Yeah.
But I think for me it was, you know, it was very early on that I was like, this is a really weird field or industry. I guess it's a little bit different on the PT side, but I don't know, you may agree. Like this could be the easiest fucking job in the world.
Yeah, you can make it simple.
This could be the easiest job in the world.
Mm-hmm.
I could make a perfectly fine salary, be comfortably paid, wake up at 7 o'clock, work from 8 to 4, check out and be good. But at the same time, it's like this can be an incredibly vexing profession or industry to get into if you really start getting into some of the minutia, and it really is a science.
100%.
And I think we kind of ignore that sometimes, right? Personability, the business aptitude and the entrepreneurial side and you know the logistical aspects of training, like all of those things come into fruition too, because you go to the opposite end of that and it's like you have this like scientist type of person who is incredibly well versed on this deeper level anatomy, but they don't know how to hold a conversation. They don't know how to do billing and administrative filing on the PT side. They don't know how to optimize a schedule. So there is the intangible aspects as well, and this will tie. We'll probably just set this as the starting point for what we're trying to get into today. But like, there is the intangible aspect as well, where you have to be able to be a good enough professional to be able to demonstrate the deeper science. Yeah. You know what I'm saying? Because like if you are a dipshit, or if you can't allow somebody to feel comfortable on a table with a stem unit on, or with cupping, or, you know, doing all these sophisticated modalities, if you can't just generate an environment that expresses comfortability and efficacy and safety, then all of your next level stuff doesn't mean anything.
Doesn't even matter. Yeah. What I was like even thinking about was, so in all honesty, like what you're kind of doing is you're kind of describing like different levels of people, like people who are fresh out that have a rudimentary understanding of what we do, and kind of like how that is a true insult to the people who are passionate about it, right? Like if you think that is just a basic, hey, there's levers 1, 2, and 3, and this is how the body works, right? You have those people, and that's fine. But then you have PhDs of the same field that are so invested into the knowledge of understanding more and more and more and deeper, and kind of like the whole dark matter thing that you were talking about earlier, right? So like you have those different of people, but where you're living is where's the application coming from? Because that's the hardest part, right? You have people who know the research, know it so well, but then true clinicians, practitioners, anyone's really doing it, then you still gotta ask yourself, well, where's the application of this? Where does it really draw the line of I can actually change stuff, change an outcome by changing a process or changing the way I do things? So that's the hardest answer. You can't really answer it, honestly, but at the end of the day, it's like that's who are the most valuable people that you're searching for, but also the ones that you can get really comfortable really fast by saying, well, how much does it actually matter? But then you have kids who undermine the idea of just thoughts with basics, rudimentary concepts and understanding, well, we can squat, bench, and deadlift, and we can get bigger, faster, stronger that way. So,
right.
Well, it's not always about that, right? Because strength, Bobby's dude, right? Strength is an expression, because it really is. It really is. I was like, I know it's like when I heard that, it's even though I feel like I inherently knew it, but never articulate or seen it articulated. And I'm like, dude, I've been waiting for years to understand this a little bit more. And that was like the quote. And I was like, huh, I get it.
That was one that stuck out to me too.
I get it.
And that's why we do shit like this.
Yeah.
Right? Like, because I feel like we're at a space right now where there's zero limitation in resources.
Yeah.
If you have a Wi-Fi connection, you have answers.
Yep.
So now we're at this point in the content and the media and the information sharing and everything where it's like, I can pick and choose between 100 different resources to learn about the mechanisms of ACL, function, return to play, surgical procedures, all these different. Nobody in the world is limited to that.
Mm-hmm.
But how many times or how many different ways do we need to see the mechanical breakdown of exactly the ranges of motion of where they should be at week 9 versus week 12, and those things of course are important.
Yeah.
But it's things like that. Like that's a great example of it, where it's like you just hear one little snippet out of a 15 or 20 minute video of something you already know.
Mm-hmm.
But when you hear it in context like that, or when you hear it in when maybe the person who says it matters too, right? I'm going to listen to Bobby a little bit differently than I'm going to listen to Joe Smith, so and so, So like those things are important too. But what it all boils down to is your perspective is the byproduct of the physical, literal experience you have,
mm-hmm.
the environment that you immerse yourself in, and then the people that you surround yourself with. That is what formulates your perspective, and that's why it's so important for me, as a strength and conditioning coach, to continue to not only meet and invest myself into people like you,
mm-hmm.
so that I can understand the technical opposition
mm-hmm.
of what we're trying to do, but I also need to understand the perspective of what these different practitioners and people are doing, so that I can help facilitate that in a more seamless manner.
Yeah, 100%.
If that makes sense.
Yeah. So like I run into this issue like personally, right? Because like being in like performance therapy, like my job is really to give the athlete everything possible for them to be able to perform at the highest level. People like you, that's where your application comes in hand, or where that is what you do. And then like I'm trying to give opportunity for that, right? So then that's when I'm going in and doing assessments and trying to understand the body. But then on the counter end of that, it's like, okay, what is the most healthy thing I can do for this person? Where can I put them in the best position, not just to perform tomorrow, but keep their body right? Because there's advantages, like there's advantages in either way you look at it. We talked about the concept of where you have like adaptive like tensioning that is like, in the literal sense, like a superpower of somebody, like I do this all the time in the clinic, and it's actually really fun. And I was working with a massage therapist one time, and I literally told her, I was like, I can guess which arm that this pitcher throws with without even looking at his arm. So what I do, get down, pull their head up to their chin to their chest, rotate, look at their how much rotation that they have at their AA joint. And then honestly, like if you're thinking about a pitcher being here and just constantly being stuck here looking at the plate, they can rotate farther to the opposite end of what their arm is. And boom, do that and you see it. And you see it all the time, right? So I'm like, hey, you can rotate really far to the left, but you're a right-handed thrower. That's great. Like I'm not worried about it. To the right, you can't move it nearly as far. Should I even worry about it? If I try to change that range of motion, is that going to reflect in changing how much you can actually have your total range of motion, so pulling you away from your target acquisitions? You know what I mean? That's it's an idea or like a thought that goes through what I'm doing. It's like, you lack range of motion here, but your performance indicators going this or like a KPI, this is where you need to be to perform at a really high level. It prevents you from opening up too soon when you're in your pitching mechanics. Because you know what I mean, you get to a certain extent where you're here. If you can't keep your head here, what are you going to do? You're going to have to turn your shoulders and make up for the lack of range of motion here. You know what I mean? So like run into that all the time, and where it's like I have a player, it's like, man, where's the ethical line to be drawn of where I'm more worried about performance than pure health. Right. You know? And it's tough. It's tough because you're prioritizing health because that is your job as a practitioner, right? Is safety and to help them as much as you can. But performance therapy is also, supposed to perform at the highest level possible. Well, what do you change?
First of all, that's going to be a fantastic plug for this article I got coming out with the next stuff. But second thing is, your experience is more on the professional athlete side, where, at least at this moment for me, my experience is mostly on the operator side with the military, and both worlds are the exact same.
100%.
Right? Because for an NFL quarterback or tight end or a baseball pitcher or whatever, right? Like there is nothing in the world that matters beyond them getting to back on the field or back on the court. There's nothing in the world that matters.
Yeah.
Right? And we can, as fans, right? I don't want to get off onto too much of a tangent here, but like I'm trying to figure out how to create this delineation between observing sport as a fan and then observing sport as a professional. Mm-hmm. And being a Raiders fan, it's becoming much more easier to fuck the fan side and just be a professional. Yeah. So thank you, Vegas. But at any rate, as a fan, I see somebody take a hit. Justin Fields was one this year that I remember watching it, and I was just like, oh my God, like that was a car accident.
Yeah.
A severe car accident. Like that dude needs to be out for a couple weeks and make sure he's okay. And Tua was another one. And then you go to the professional side. And with the professional side, we do have efficacy of practice. Mm-hmm. But as a professional, I also now, my job is to facilitate your goal. Mm. So your goal is to get back on the field, because if you don't get back on the field, you're going to get fucking replaced. Mm-hmm. And if you get replaced, you get cut and you can't feed your family.
Yeah.
So now it is a really difficult ethical dilemma. But with my previous world with the operators, it just kind of started to occur to me where I'm like, you know what? These are consenting adults that knew what they signed up for, right? War is the most treacherous thing in the world. Yeah. For us, outsiders or observers. For them, it's the Super Bowl.
Yeah.
There's nothing in the world they would rather be doing than be overseas.
Yeah.
Right? And at first I was like mind blown. I'm like, oh my God, you guys actually, that's what they want to do more than anything else in the world, and it's what they're paid to do. So now my job as a strength coach or as a practitioner is I need to specifically and singularly focus on how I can fix this knee and expedite their return to duty or their return to play as best as I possibly can while staying within that ethical realm.
Yeah, yeah.
And that's tricky.
It's so hard. And I run into it all the time because, there's a certain degree of when you're working with someone 5 days a week compared when you're working with someone twice a week for 6 weeks. You know what I mean? So, you're always trying to pick and choose about how you're going to do things and how you should kind of program it. So for anyone that's in true sports medicine, there's actually an idea of where you should be able to program or periodize your rehab. in like a 5-day span, like just like you would do for any other programming itself. Like I know that, I don't have to work on your knee every single day, 5 days in a row because your knee is hurting. That gives me the opportunity to hit you with as many different types of stimulus to treat the overall body because I had that pleasure of doing it. And that's where, even like when I have students that do come in now and start to work with me, that's the thing. It's like, hey man, like, their knee hurts, but there's a reason why their knee hurts. And it may not be that you need to make their knee just feel great every single day. Take a chance, since you have the privilege of getting to know someone over a 5-6 day span a week for 12 weeks during the off season, where you can explore the whole body. You can understand it a little bit more. And that's like one of the things I could say that like I took a much appreciation through the education I went through. I remember being in on my anatomy labs and stuff like that. And one of our big sticklers was, our professor would come by and he would basically say like, oh, what are you doing? And if you're like, oh no, I'm just like cutting the skin away or cutting the fascia away. It's like, that was one of the most poor answers to give because there's no true thought or explanation to it. So the idea came about, my answer every single time you would ask or call on me, I'm exploring.
Yeah.
At the end of the day, I don't care if it's I knew the answers or if I knew exactly where I was at in my thought process of what I was supposed to learn at the time. As long as I had the intent of going in to explore, I'm gonna learn at an exponentially rate faster than anything. You know what I mean? So it's like you give that to the patient whenever you can be able to work with them 6 days, 5 days a week. Is hey, you explore more of what's going on, and it's the idea of not knowing is what is fascinating.
And that's why we get along so great. So
yeah.
I guess that's a perfect opportunity to formally introduce. So very pumped to have my guy Jimmy with me here for today for this. And I guess this is immersive programming 8 or some shit or whatever. But obviously the construct of what we're getting at today is the return to play. And Jimmy being a physical therapist and me being a strength and conditioning coach, who have both worked in interdisciplinary settings for a few years now. One thing that really the prompt of this conversation is, number one, how do we work in tandem to optimize the situation of an athlete, and how do we better understand either side of the fence? Because I've mentioned this several times before, and as we've talked about, like, I had a phase at VHP where I almost started feeling like a fraud, right? Because here I am as this CSCS, I lift weights and sprint people, but 90% of the people that I'm working with are severely and significantly injured. And, with the recipe at VHP, the environment at VHP was just so special. I mean, it was really an indelible type of environment that was very conducive to the way that I think. And my former boss, Alex, who's had an extensive military career himself, was very outcome driven. His literal instructions for us were, fuck the problem, find the solution.
Yeah.
Right? Like we will figure out whatever it is we're working with, whoever it is that comes through our doors. And so I took that on and I sprinted with it. And it was like, okay, I may not be a physical therapist. I may not be an athletic trainer. I'm going to figure out how I can apply strength and conditioning, right? I'm not in here dry needling people. I'm not in here hooking people up to STEM units, right? I'm doing things in a way that are within scope of practice, but are also pragmatic for what the athlete needs and what we are able to provide. So I wanted to kind of throw this question at you to start it. Let's start very broad here in just that. What is an injury? How do injuries occur? And then what is the initial kind of like process that follows thereafter? Because, we can say biopsychosocial, whatever, but, the reality of it is that it is a really intricate thing where there's a mechanical element, there's a physical element that occurs that changes how the body is functioning or impairs the body's ability to function. But it's like, that's just scratching the surface.
100%.
Fixing an ACL, right? Or rehabbing, I shouldn't say fixing, rehabbing an ACL is a sophisticated process. There's a sequence of steps and things that you need to do. But it's like, man, that's just one piece of it. Like you were already alluding to, like, how am I connecting with this person on a human level? How are we providing strategies? How does it differ from this person who has this set of circumstances to this person who has this set of circumstances?
Mm-hmm.
So what does that all mean to you? What happens? How is an injury occurring? And then what does that initial process look like from your perspective?
Yeah. So I guess like to set like a standard, it's regarding like majority soft tissue, right? That's what we're going to talk about. So like in all honesty, like what I initially think about when you say that type of question is, you know, it's going to come down to speed, you know, at the rate at which the injury happened, right? The mechanics that are associated at the point of contact when it happened, and then true nervous system ready to take on that action or that outlier input of what you would call a mechanism of injury, right? And when it comes down to it, like that is all in my head. It comes down to saying, did the athlete have the movement literacy or movement variability to withstand the external force or whatever may have happened at that point of contact? So that's what I really think an injury is, right? Is preparation, it's variability, and then readiness. And like in a way, we measure a lot of these things, right? That's the whole idea of like VBT and how it is somewhat of a superior application than some things because you get to tap into understanding like the nervous system itself.
You're at least prioritizing the velocity component, because like that's, you know, my little succinct phrase for it is that tissues tear when they're loaded faster than they're able to respond.
Exactly. That's my point.
Not necessarily more than they can handle.
Yep.
Right? Because we've seen in a million different ways, like with eccentric loading, we can tolerate up to 120% of what we can produce.
Mm-hmm.
So barring catastrophic situations,
mm-hmm.
right? Car accident or just because I said his name a minute ago, but like to his hip at Alabama,
mm-hmm.
right? Like the catastrophic injuries speak for themselves.
Yeah.
My fascination, and I don't want to do too much on this today because we're already going to do another video on this, but how can somebody back squat 500 pounds, you know, whatever, run a 4.4, do this, that, and the other, and then jump and tear an ACL?
Yeah.
Why do non-contact soft tissue injuries keep occurring? Because if it were just a force deficiency problem, we would treat everybody like a power lifter,
mm-hmm.
and you wouldn't have a job, and I wouldn't be very valuable.
Yeah.
You know what I'm saying? Like,
squat, bench, deadlift.
So it's very, very, very interesting. Because the mechanism of injury should just make sense. It should be, I measure this knee and it can produce all the values that you were providing, right? Like it can produce this amount of force so it can withstand this amount of force.
Mm-hmm.
But we've seen a million times over. It's like, that's not it. So the injury process is very, very confounding. And that sets the template for the psychological part of it,
mm-hmm.
because I know for a lot of the guys and girls that I've worked with in the past, their inclination is to try to like justify why the injury happened,
mm-hmm.
and that's a fascinating thing.
Yep. Because
you would think it's like if so and so, you know, running back cuts, foot slips out from under him, we get internal rotation, valgus, boom, foot goes, ACL's gone. Okay, well, mechanism of injury is there. You tore the ACL, it just happened. But they tend to think about it like, man, I trained for, 12 years. I never missed a day, and I did all these different specialized treatments. And why can that happen if I do all the right things? Mm-hmm. And as somebody who is an injury specialist, right? How can those things happen?
I mean, that's the ultimate question, right? It really is. It really is. And it's like, if you knew it, then you would basically be able to sell anything when it comes to like rehab or performance. But I mean, I think that like say post injury, the idea that happens is like you want to somewhat victimize it in a way. It's like, this is why I tore my ACL, and you'll see that on a huge stance of say general population. It's like, well, your glute med's weak, or your hip abductors are just not there. They're not as strong as they need to be. It's like, well, and that like this same type of concept of like glute activation stuff kind of gets under my skin
Please
in a
talk
way.
about it.
It's just it gets under my skin because I'm like I don't understand what that even means, because like that would mean you would be down on the ground. You know, you wouldn't be able to stand if this stuff's not activated, or the strength or whatever it may be. I guess there is some truth to it, but very minute, especially when you're dealing with athletes, I think. So you can look for asymmetries and then kind of point them in certain ways, but everyone's built in an asymmetrical way anyways. So I really don't
That goes more to margins.
Yes.
Right?
Yes.
Because we do agree on that. And actually, Matt Jordan is somebody who has a ton of fantastic research on this.
Mm-hmm.
And his value tends to be right about 15%. Right? So the way that I took on the asymmetry thing was, there's functional asymmetry and there's non-functional asymmetry, and we have totally bastardized that.
Yeah, 100%.
Right. Because it's I get frustrated in the same way, where it's like, you know, the people who are super gung ho about like, well, you know, you only have 3% more plantar flexion on this leg compared to this leg, and this is your dominant leg versus your non-dominant leg, and then like, you know, so if we, and I'm like, all right, God damn it, slow down, right? Like, but then you have the opposite crowd who's like, well, Usain Bolt has scoliosis and he's the fastest person alive. And I'm like, dude, that is clearly an outlier, n equals 1.
Yeah.
So both ends of the spectrum are wrong. And I will always take full advantage of an opportunity to take a shit on Goda. This is where people like that are completely missing the boat too. Because like you're saying with the glute med, their thing is the whole ankle position and foot position. And it's like, if they weren't a complete, you know, just absolute collection of douchebags, then I would probably give them a little bit more credence, because their technical points on the foot position and on the ankle positioning, I agree with. I think it's actually really good shit, and I've taken a lot of it. But where they completely lose me is where that becomes the start and the stop.
Yeah.
Right? And like, it's like, if you have your heel in this position, you're going to tear your ACL, and if you don't, you won't.
Yeah.
No way, man. And it's just so much more complicated than that. But getting off of my shit bashing, let's think about it now in terms of like, well, let's start simple here. What are like your top 2 to 3 priorities for an athlete in a return to play phase? So we'll give a little context here. We'll say like an in-season NFL or college football athlete that's coming off of, let's say like a high ankle sprain or something that's not season ending, right? Mm-hmm. What is at the forefront of your mind from the injury occurring to getting that player back on the field?
Yeah. So like, just run with the idea of like, say, a generalized ankle sprain. I mean, like, the first and foremost priority is to understand physiology, you know, because everyone wants to accelerate rehab processes. Well, we need them on the field tomorrow. Well, you know, physiology only moves so fast. Right. So you have to be comfortable with that. And it's the hardest answer to really give anyone, even especially when you're working with like a team or someone like that, or even the player. It's like, they want to be out there as bad as you want them to be out there. Like, they would give anything to be back on the field, 100%. But at the end of the day, like, you know, you got to stay safe into the idea of where physiology actually lies at the time of injury, and what that actually looks like on a recovery timeline. So the first initial days, you know, there's only so much you can really do before you can start compounding some results on quickly, you know? But like, prioritize your physiology at the very beginning, and then like obviously generalize like swelling, controlling swelling, getting them back to form function, and then straight into performance. You try to do it at the fastest rate possible. My idea is, hey, say like an ankle, it's like, I'm gonna get them back up on their feet, get them moving around, get actually every resource I have, rather than it being supported by pure evidence or not. Like, give them the resource to see if it helps them, you know, because that's the big thing, right? You know, same with ice, right? Do you need ice for every injury? No. Is it the best idea? Probably not. But, you know, if it's worked for that guy for 25 years and that's what he lives and dies by, I'm giving it to him. 100%, because that is where my duty as a practitioner actually is more than the research. You know, it's actually the human piece of it, you know, being comfortable with understanding, hey, do I necessarily agree with what he wants to do? No, but you know, this is going to make this process quicker, and there's a huge psychology psychological component of him being ready to get back.
And it's probably not going to directly make him worse.
Yeah.
So as long as it's not going to make you, or as long as it's not going to move the needle in the wrong direction, whatever.
It's like, always think of it like taking like multivitamins, right? You go out there and you read some of the research on multivitamins. It's like, it's not crazy, right? But at the end of the day, someone's going to read that like, well, it's not really proven to really work. But you know what? It's not proven that it hurts you either. So why not take the opportunity to get better, you know, or try to help your body in one way or another? And that's how I kind of look at a lot of things in sports medicine is, you know, hey, where's the opportunity at? Does it give us the ability to possibly get better? Great. Does it make it, if it's going to make it worse, then we're not doing it. But, you know, if it doesn't make it fixed tomorrow, then, you know, I'm all for it. I'm willing to work into ideas with players. Kind of still going on like the same idea. When working with professional athletes or really any athlete, there's a huge part of me where when I'm sitting, I just talk to them and I understand that, hey, their job is their body in the way it works. So it's not the egotistical route of like, hey, I know your body.
I'm the best, yeah.
I know your body. This is what I've studied for the 8 years or 7.5 years of schooling that you had to go through to become a physical therapist, anything like that. At the end of the day, it's like, dude, you've been in your body your entire life. You know the feelings that you have and what they kind of reflect, or a situation that you've been into prior to meeting me.
Yep.
And I need you to express to me, like, how did they go? What did you guys do? Was it effective? What did you like? What did you not like about it? And I do that like often on, I'd say, initial evaluation, post-op, or say ACL. I've been getting a lot of ACLs that are, you know, in that 6 to 9 month range, or where they're just not really there yet, but really couldn't do traditional PT anymore. And the first day is, hey, what have you been doing? What has really worked? What things have you not liked about your past experience working with someone? And like, let me know those things, because they know their body way better than you do. And I don't care what anybody says. Athletes know their body better than you can tell them that their body is like functioning.
Couldn't agree more. And it's almost like that's a really articulate way of demonstrating I don't know what I don't know.
Always.
And it's beautiful. So it's funny, man, because like this is actually a great segment to really start with, because even knowing you personally and even like having some understanding of how you do your shit, when I ask you the question, what are the 3 priorities of return to play for your world? Sitting right here, right now, my mind is like, all right, is he going to go into, you know, the fluid mechanics? Is he going to go into, you know, measuring the joint angles? Right? But the first thing you said is we got to make sure everybody's on the same page.
Yeah.
Right? And we got to control the surrounding environment. Right? So it's like communication and being in a good professional is the first step. Right? So for young practitioners and young coaches, don't get too excited about methodology and treatment protocols and principles to the point that you ignore that kind of stuff. And this is where, you know, we all know know someone or have experienced the horror stories of, you know, going to bat with a coach or going to bat with, you know, a manager or a coworker in a private sector setting where, you know, you're trying to tell a head coach, yeah, but the reduction of range of motion of the knee is going to, you know, increase the likelihood of a subsequent injury. Yeah. They don't give a shit about any of that, right? So it's like you have to be right out of the gate, very clear and very directive with how we are going to make this a conducive environment. It's fascinating. And then the second thing that we kind of got into was almost like borderline placebo effect, right? Because that's another one where like, if somebody who's, you know, uneducated on being a physical therapist, so, you know, myself for sure at times in the past, I would hit Jeremy up, my guy Jeremy Aspa, for the silliest things, right? Like, what should be the ratio of heat to ice? You know, what should the shoulder flexion be after a slap tear? You know, at 9.5 weeks, and he would actually really have a lot of the same input. Well, it's like, well, is there pain when his arm's overhead?
Yeah.
Right? Because if you go to the textbook and it's like, slap tear, boom, week 1, they can do this. Week 10, they can do this. Week 12. And we all know, like, that's just not true. That may be a composite of averages or, like, the most predictive timeline that we've been able to create. but it's fucking messy.
Yeah, it is.
It's super messy and it's super individualistic. And I know slap tear specifically, that's probably the number one injury that I've worked with. I've had people that can get to here and their arm starts tremoring. And then I have people that have 225 overhead, no problem.
Yep, and they can just master it.
Sometimes it's a problem, sometimes it isn't. What is your thought on that? On like the individualistic response to injury? And I know that that's a super complex topic, but like what's been some of your experiences on that?
Yeah, and like to put it into like an entire box is that you move away from like pure objectives and you move into like criteria. You know, like you make sure that they can check certain things off, but not say hit a objective number of like, hey, your strength has to be at 95% limb symmetry to be return play sport athlete, you know, which is like the research, and that's what you kind of want to follow that and understand it at a really high level. But then in the day, it's like, you know, they may not be a perfect 1-to-1 ratio with the research because for one, they're different humans, you know, that just makes sense. But for two, it's the expression of how they're doing certain things regardless, you know, and it's hard. I hate to like go back to it, but that's what it is, you know, I look at certain metrics, say just to go back to ACL, like for ACLs, I'm looking at a lot of strength that is happening here at 90, then a lot is happening here at like 30 degrees, right? And I tell patients, it's like, hey, like they're going to be different to some degree or fashion. Sometimes I've worked and turned around and the ACL side has gotten way stronger than the non-tour ACL. But that's because you're at this baseline of saying like, say injured side, non-injured side, you're working and then you're trying to catch the non-injured side to the the injured side to the non-injured side, when ideally you should be trying to chase something that's improving over a period of time. You know, does that make sense?
It does.
And I have a guy right now that we really express that to. So what I do is like, I'll get his metrics from baseline and say his limb symmetry index, which is just measuring say quad strength at 90 and say 30 and comparing the two sides. We went back, and this was like the other day, we went back and we retested it and we got his numbers and we compared the numbers directly. It says same day, testing here, then testing non-effect side, testing here, comparing the numbers. And numbers were good, right? They're perfectly fine. And I pulled up his first day here and I was like, okay, this was your non-injured side when we averaged it out and we got these numbers. Let's take your injured side today, compare it to your non-injured side from day one. Compared them, matched them up, and I'm like, dude, you're like in the 90th percentile. But today you're showing me you're in the 70s.
Right.
And that's where it's kind of like confusing in a way, even for my same understanding. It's like, man, it's like, where are you trying to chase a sinking ship, or are you trying to chase something that you're constantly elevating? So when it comes down to it, it's about like criteria, how they're expressing their strength qualities, not exactly what the strength quality is.
That's brilliant.
You know what I mean?
Yeah.
And you see it, and that's why it's like not a knock to any professions. I talked to my buddy Nick, Nick Simi. One day we were on a phone call and we were talking, and he said, you know, there truly is, he's PT going back to school to become an ATC. So he's went through the entire education of getting his doctorate. Now he's getting his ATC degree, which is like, I admire it, you know. But he really told me, he's like, there really is a eye for it. He said, it's not about just loading somebody or seeing what they have. He's like, there truly is an eye for it. And that's what you're kind of, I would say the educational system for PT schools, like you're taught to how to look at it from a perspective. And that's where the value is truly at. Not measuring. Measuring doesn't, range of motion only matters so much to a certain degree anyways.
What's the context? And
exactly. It really does. So it's like, it really is like, there's an eye for it. And when we talked about that and he said that, I was just like, man, you're right. Like you can load someone and you can get some sort of result, but you know, like you got to be looking for the right things under load or not even under load, you know?
And what are those things for you?
I mean, like it's be able to withstand, like, say external forces, say be able to hold a good example would say visualizing and literally looking for say your knee lag whenever you're doing a straight leg raise after ACL. Like a lot of people will be able to just take their legs straight up when they're in the supine position, but are they actually able to keep that straight the whole time, lift it up effectively? I could pick my leg up at a bent knee all day long. Quad's not strong. I can probably stand up to some degree and be strong here, but like I wasn't even ready down here until my leg is completely straight. So there are things, but you're not measuring that. You're not quantifying that. That's a visual type of thing. But those are the things that kind of do matter because that's the expression of him being ready for the next step.
So that's like that's wild because as somebody who is not conventionally trained on the rehab side of things, I was always very reliant on my eye and my ability to kind of pick up on context clues. So like for me, like when you first mentioned that and you started talking about the eye, right? Like, so for any strength and conditioning coach who's worth a shit, you try to model yourself after like Dan Pfaff, like with ability to like listening to that man describe movement is like audible porn for me. It's unbelievable. I mean, you talk about somebody who's like watching somebody sprint and then it's just like, yeah, left hip is anteverted, right hip's retroverted. I'm like, how in the world can you see that? But so that's who I chase in that regard. And so as it applies to the ACL, first thing that sticks out to me is what do the shoes look like, right? Tread on the bottom, where the lace is sitting. I've noticed that especially with lower leg injuries is like, if the base of the lace sits more laterally on the foot, then they're probably trying to bypass going into too much extension during their gait.
Okay.
The other one is I'm going to kind of assess or check hip flexor on the opposite side. And if we have a left ACL injury and the right hip flexor is extremely locked up, tightened up, whatever the word you want to use is, right, then that tells me that they're not really pushing into extension on that left leg.
Yep.
So if they're not pushing into extension on that left leg, is that because of pain or problems at the ACL? Or is it a compensatory strategy that they created during rehab or the rehab process that now needs to be addressed as they're getting back to full health? Or is that just their dominant leg when they walk, right? Like, so it's like you have to be able to detect these things and see. The other thing is the shoulder, right? Like with with the knee, if we have a shoulder injury, where does their head sit?
Yep.
Right, like you were just talking about with the pitcher. If I have somebody who's coming off of a shoulder injury that just naturally cocks their head like this, my initial thought is that is them trying to create a situation or a posture that is comfortable for them based on the injury, but it's not always the case.
Yeah.
So you almost like have to investigate these different context clues, but you have to do it with like a little bit of reserve. And that was definitely an issue of mine and an error of mine where, I'm sitting here talking shit about the go-to people, but like I would immediately see something, and because it was very repetitive in that military environment, everybody has the same build, everybody does the same training, everybody has the same demands. So you get a lot of repetition, and I would see these certain things, head tilt, shoelaces, blah, 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 and I'd be like, I know what's going on.
Yeah.
But that well runs dry.
Yeah.
Eventually you start to see, like, even if something is, 80% accuracy, that's 20%. You can't assume.
Facts. So
you can't.
If you're not assessing, you're guessing.
Right. One of the best things ever.
It really is. One interesting concept that was introduced to me is like, obviously form follows function, right? There's this picture that I remember seeing in school that they had a guy sitting at a desk and his head was tilted like this, right? And he sat like this all the time. Well, like when I was in undergrad, I actually worked for a developmental disability facility, and everyone was wheelchair bound, nonverbal communicative or anything like that. So I think that's like one thing that's kind of like really helped me in my career is like I worked with nonverbal people for years, and that just elevated my communication understanding of everything else. Everything else made me appreciate everything so much more.
100%.
But the idea was, you got people who sit in a wheelchair that may be stuck like this for their entire life. So their entire grid system is basically here to move here, then compensated by this. So like if you move them upright and you get this type of this training whenever you're doing like wheelchair fittings, you can't just take someone here and put them straight up. because now their whole system is still over here,
Wow.
and it's just overly compensated, right?
Yeah.
So like, if form follows function, you got this guy who's in this picture. He's like this, and all the pictures on the wall are all shifted over, and they ask him like questions like, "Why is everything tilted in here?" And he's like, "What are you talking about?" And it's because his visual system is compensated for everything else.
Beautiful demonstration of relativity.
You know what I mean?
Yeah.
So it really is. It really does matter about like where they're at, why they're doing it, or like is it actually following suit of what they're supposed to be successful at in some degree of capacity.
So you know how much I love just talking with you, and especially on the theory side and the hypothetical side. But let's make sure we give the viewers and listeners here at least something context and concrete.
Fair.
So let's just walk through an ACL. It's a very common injury, one that you're very, very well versed in. So what does it look like technically? Like, what is your process from when you see them to when you're transitioning back into a strength and conditioning facility or back to the strength and conditioning coach?
Gotcha.
Right. And then I'll kind of, see where I pick up on that.
Yeah, for sure. So like, say day one ACL, they walk in and stuff like that. Really, the two major buckets that I'm separating everyone into is contact, non-contact. Makes sense, right? Because there's a different approach to it when it's non-contact versus contact. Like generally contact injuries are going to be, I would assume, pretty easier to go through. You don't want to make the total assumption of that, right? But is it contact, is it non-contact? You go through these progressions of where you're going to try to pick out all of the deficits to some degree of capacity, or whatever that may be. It could be that if it's non-contact, this is where bodily strength actually comes into some degree of a factor of what you could consider, but more so it's more of the force absorption type stuff and dispersion. And we talked about like the Achilles for a big thing. So usually a dispersion problem is an absorption problem than anything whenever you tear it. But you have these ACLs, they come in, I try to put them in somewhat of two different buckets. You're going through rehab, obviously respect the beginning stages, because the beginning stages are probably the most important, because your job is to not tear the ACL that just had a reconstruction on it. That is your job. Get them to do as much as you can have them do, but not tear their ACL that they just got reconstructed. That is like the biggest advice I could probably give anyone. But be confident in what you're doing. You really do have to have that. The biggest concern is really the bone screws actually setting into the femur and the tibia and making sure they're completely healed. Because at the end of the day, whatever structures going in there, rather it be patella, quadruple hamstring, any of those, they're inherently going to be stronger by the time the complete healing phase comes around. Rather that be 9 months, year and a half, 2 years, don't know the answer to that. But, inherently I try to tell them like, hey, listen, you're going to be stronger. It's going to be stronger in your body with given time. And that's an important thing they should know, because at the end of the day, it's like the psychology that comes behind it is that they're scared that they're going to tear it.
Oh yeah.
That's the biggest thing that you're fighting with someone that's getting into a pretty functional state. It's like, oh yeah, no, I'm strong. I measured it. Metrics are there, but I'm not comfortable. Yeah. I'm scared. It's like, okay, this is a problem, But everything that's going to go into it is going to be pretty much stronger on the back end. Stiffness kind of gets up there where it kind of being too stiff of a structure is problematic, because then your stress strain tolerance is going to decrease, right?
And I know it's probably a depends thing, but do you notice that being more because of the way that the surgical procedure has been done, or because of the lack of fluid, because of the lack of movement?
For the stiffness quality, I think it's the structural idea of what they're bringing. If you look at it and you look at the actual stiffness and just pure strength of like quadruple hamstring, it's literally like double what a native ACL is, which is like mind blowing. And so it's like, how come we wouldn't just do that for everybody? But it doesn't work that way, because at the end of the day, it's like, it's strong, but it's way stiffer. So
and if you take something from somewhere and relocate it, there's some kind of change to the system.
Exactly. And you're not, if you're too stiff, it's a good thing and a bad thing. But if you're too stiff, the variability of being able to accept something that's external, I would say it kind of goes down in a way, right? If you don't have any laxity to give into, be able to bend into a position, accept it, and let it actually stretch out.
Can't load where you can't move to.
Exactly,
Yeah.
exactly. And that's why we always stress like the movement variability. So I try to give those perspectives to the patients as they're going through. Say if you get to around that, getting close to 6 months where, these athletes they're getting strong. You may be monitoring some of the actual like objective measures that are most important to you, like limb strength and
Quad atrophy or
yeah.
What do those look like for you?
Yeah, I mean, you're going to have quad at the very beginning of the stages. You're definitely going to have that, and that's where you put a ton of emphasis on trying to just get it kind of like reactivated in a way, because the inflammation process really does shut down that quad.
Yep.
Like there's a reason why you can't go get a total knee replacement and stand up next day.
Right.
It's just so inflamed, it shuts it down. Quad inhibition, you hit the ground.
Yep.
Same thing goes to ACL. There's a degree of where it's functioning, but it's not going to function at 100%. So you do have to get back to it. You have to trust physiology. You have to give it time. You have to work it. You have to give it as much input as you can. And this is where I still utilize like Russian stimulation and stuff to have them do contractions whenever it's firing with them, to give them as much as they can. I know part of the education I had at the very beginning is, you don't load them too quick. And a lot of that looked like, hey, you make sure that you only load them in a close kinematic chain in the early stages of rehab, right? It's not necessarily true. If you go back and you just look at a lot of the research, you can have them do daily activities which stress the ACL way more than it does doing an open knee extension. You know what I mean? So like I immediately get them onto stuff like that with Russian stimulation that gives them that extra input. And it gives them the confidence to be able to be successful at things, because I think that's a huge part of it.
I think that also provides a little bit of tangibility to it, which is also very important for the athlete's sake, because while, someone like yourself, you're filing everything away up here, like check, 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 check as they go along. But for the athlete, it's important that they see reaffirmation and reinforcement that like I am tangibly demonstrating improvement here.
Yeah.
My quad the other week was 14 and a half inches and now I'm at 15 and a quarter. I am showing growth and development, and that's fundamental.
Yeah. A really good idea is like, I have a guy, quad tendon repair, patella tendon repair, 1.5 years out, go through, do all this stuff, and I have him do a single leg jump. This is like day 2, right? He's 1.5 years, so he's safe when guarding actual structures of what they healed and stuff like that. But it looks like crap.
Yep.
It looks so bad. But you know what? I have him do it every single day. And then just the other day, I go out there and I'm looking at him doing a jump, and he's bouncing. He's being a little springy off of it. And I'm like, we've been doing this for 2 months. And I had you do the same thing for 2 months, just single leg jumping. And now look at the quality and confidence you have in this. And he's like, yeah. He's like, I feel really good.
And that's really where it starts to get into a lot of the undefined space. But, whether that is, just psychological reinforcement, I wouldn't even know how to describe that more technically, but whether it's literally just them seeing and understanding that they can do something that provides this, again, undefined ability now, where mechanically they could have done it 6 weeks ago, or 6 months ago, now you've shown him definitively, I can do this and I'm safe. Now we can continue to get better.
Yeah.
Or is it more of like the actual neural, re-network development and all of the heavy, who cares?
Yeah, to a degree.
Who cares?
Yeah.
That's the whole thing that, and I'll go ahead and, transition that into my side now, because that's a very good description of like a strengthening and conditioning coach's perspective on injury rehabilitation once the actual experts have done it, right? So like once they come to me, my big thing is, like you said, the first thing that comes to mind for me is that phrase that we've talked about, you're not broken, you're building, right? And when you have the alpha athlete, or in my case, the military person, it's, they're so resilient to showing like, oh man, I'm fucked up, or I've got an injury, or I'm compromised somewhere, and so I think that because they have to put so much emotional resource into creating this like stoicism about their injury, right, that like it really kind of eats away at them, you know, because you're physically dealing with something. Mentally, you're trying so hard to get back to what you love to do, and then just on a day-to-day, you basically have to, you know, deal with all of this redundant input of how's the knee, you know? So what I started to latch on to was, you're not broken, you're building, right? It's just something that happened. It has now been repaired or attended to, and now we are in this literal accumulative process to get back to play. And it's important that you don't have any fucking like shame or vulnerability in that. Like, shit happens.
Yep.
You know, whether the injury was something that was causal, you know, somebody did something that created their injury, whether it was something that just happened to them, it is what it is. So it's really addressing the mentality piece first, what I'm getting at there. But to some of the more technical things, I am very big on everything but the localized issue, right? Because the way that I see the general divide between PT, ATC, and then strength and conditioning, human performance, the early phase or your side of the fence is localized. I'm going to treat the injury, or I'm going to treat the area that's it has been damaged. My job or responsibility is now to reintegrate what you have repaired back into this global system.
Yep.
So I get the easy part.
Yeah.
Right.
Not really. It's difficult. It's difficult to have that understanding because it's not an intuitive thing. You know, you're treating a system, and like then it's my job to be able to communicate to you what I physically find as from an assessment standpoint, to say, hey, like these are things that I really when I assess him, I see, and it doesn't really make sense to me. Maybe we need to do something a little different with this athlete, you know, because that's where the global idea is coming into. Is like, hey, you're trying to treat the whole thing, and after the initial localized treatment has been effective.
And we have an ACL injury that occurs right here. This is a structural, clear, tangible injury. When this injury occurs, instantly, everything else changes.
Yeah.
Everything else changes.
Yeah.
From the physiology to the biomechanics to the compensation patterns, all these different things, right? So again, like my perspective has always been like, Jimmy and my PT staff are going to take care of the structural ailment or limitation that was present, and they're going to put that thing in the best position for me to then reintegrate. So this is, if I guess we have a quick little sidebar there, this is where it goes back to the trust in each other as a staff and in this interdisciplinary setting, to where you tell me what those boundaries are, those are the boundaries.
Yep.
If he or she can't do this amount of volume, this range of motion, this amount of speed, then we're not doing it.
Yeah.
Right? Like that's an issue with strength and conditioning coaches, because with strength and conditioning coaches, either they don't have the wherewithal to get those values and they just assume that they can identify them, or B, they become egotistical about it and try to override it.
Yeah.
Right. And then we have the other way where, you know, PTs get a little bit overzealous as well, where they strap down all these limitations. And it's like, well, what the fuck am I supposed to do now if I can't do anything?
Yeah.
So this dialogue that we're having right now, like if there's one major takeaway for anybody who's checking this out, it's like, be very sure of the people that you're working with. And when you have this crossover, which this whole industry is pushing towards, is everybody is eventually going to have performance and then restorative or rehabilitation. It's going to continue to happen. The trust between the staff members and the coaches is imperative, because you don't have time to discuss those things.
Yeah.
Like,
it's priority.
You do the expert. You provide your expertise. I'll provide my expertise, and we don't have to worry about challenging or questioning that, because the priority is the fucking athlete.
Yep.
Right. So now back to what I was getting at a minute ago. I'm going to look at the foot first, foot or hip, right? Give or take, depending on who it is, and I want to see essentially what does the medial lateral foot control look like, and what does the foot compliance look like? Because if you spend, you know, really 6 to 12 months, not weight bearing, but like reduced weight bearing, it's not just the knee that's gone without stimulus or stress. The foot is the same.
Yep.
So we have to kind of resituate down there. Then we go to the pelvic balance, where if I have a left ACL tear, like we said, the right hip flexor is most likely going to be, you know, hypertonic or whatever, and a little bit bangled up, and then we're probably going to be weak on the glute on the ACL side because of lack of activation or lack of loading. So I'm going to basically just kind of pick out what the most glaring deficit is, or what I believe to be the thing that I can cover the most ground on the least amount of time. And then I kind of just let the process unfold and show me what's needed, you know? So like, it's like you said, it's like if, actually I'll give two quick examples on this. The trust thing was a fascinating thing for me because I've had people that would be up to 15, 18 months removed from post-op, and we'd be doing band pull-aparts and a TRX row for getting blood flow going, warming up, and then I'd say, all right, we're going to go hit a set of lunges. Oh, I got to go get my brace. It's in the car.
Yeah, right.
Like, what do you need the brace for?
Yeah.
Right? I just watched you lunge off the ground and walk up the stairs, no problem, but now because I tell you we are doing something specific to that joint, it prompts you, I need to go get a protective mechanism. That tells me you don't trust it. We're going to do exactly what you just said. We're just going to jump on one leg now every time I see you because I'm going to show you that you can.
Yep.
The other thing is where is the lag in the other parts of the body, right? Because it's again, this is a system of systems. So whether it's an ACL tear, it's an Achilles tear, it's a hip resurfacing, whatever it is, there has to be some levels of compensation and trade-off elsewhere that for a period of time are strategic and effective for them, but then eventually are probably going to either run dry or create off-branching problems.
Yep.
So now let me position this to you. Where are the main talking points that you want to hear as a PT and being in more of the early phase of rehab from the strength and conditioning coach after you have set them free, so to speak? What are some things that you want to hear?
Yeah, so I'll back it up a tad. So the main priority that I'm trying to push a patient from the PT sector into the strength and conditioning sector would be more so I want them to participate in chaos, because that is literally what you guys are probably the best at. You know, like my idea is like I create a very controlled environment to be successful, and success is the most important part, but chaos is where they're going to thrive as an athlete and where they're going to benefit from, you know? So that's where the conversation always comes down to is like, well, are they ready for chaos? That is what I'm kind of like really objectifying in a way, subjectively, but in a way that like, hey, this is when I know they're ready to be passed on, and their numbers may not be perfect, but you know, if chaos is where they're going to thrive, training with, say, groups, they're going to be training with other athletes, or training groups, training with athletes, or even being able to be in a foreign environment that they're not comfortable with, right? Doing PT with someone for 6 months and then get thrown to someone else that's going to be pushing them at a very high level, very stressful. You know what I mean? So if I give you a patient, I've been 6 months, they love me, they've been working with me, they get thrown to you, and like you're like, we're going to work today, and they're not ready for that, the readiness, that's where you get to expose them to see if they're truly ready. So dosing them into that. But the communication that goes back and forth is a forever constant thing. I think that the priority of are they ready, are they healthy to do it is going to be the thing that's primarily focused on between the PT and strength and conditioning coach, which it always is. But yeah, once they're ready to participate in chaos, I'm sending them straight to strength and conditioning.
That's excellent, man. And I know I can't fucking believe it's already been an hour, but
yeah.
I know we'll kind of bring this thing into a wrap now. So I'll actually answer my own question first, and then I'd love to hear your side of this. But, you know, like I said, everything is kind of converging together. We're all trying to kind of create these one-stop shops, and then at the same time, especially since I've gotten down here to Texas and talking to a bunch of new people and meeting some new people, it's just amazing to me the redundancy of what seems to be this pervasive issue of why do organizations have problems? Trust, communication, exposure to methods. Or in other words, NFL team A or NBA team A, the strength and conditioning staff meets over here and they talk about their things. The rehabilitation staff meets over here, they talk about their things. and they do not share those notes.
Yeah.
So then a player does not do the correct thing, which then leads to a subsequent injury, which then means the head coach gets fired and everybody gets canned.
Yeah.
Right. So that's why I think that this conversation we're having today is extremely important, because like we've talked and exhausted the methodology, we've exhausted the principles, but shit still isn't working right.
Mm-hmm.
So we'll close on this. The last thing that I wanted to touch on was the best thing that a PT can do from a strength and conditioning perspective. So if I'm giving unsolicited broad stroke advice to a young physical therapist from an S&C perspective, lift weights.
Yeah.
Go lift weight. Train hard.
Mm-hmm.
Train with your strength and conditioning staff. Right? You know, I can attach onto that, like sit in on the sessions when, you know, strength coach is working with the athletes so you can understand the methodology and application a little bit better. But even that is, it's passive. There needs to be integrative overlap. So I want to see a physical therapist who benches, deadlifts, cleans, squats, sprints, does good, true training. The other thing that I would encourage for physical therapists from the strength and conditioning perspective is understanding the value of quality strength training.
Oh yeah.
And I say this respectfully, but it has come off to me in the past that a lot of PTs just think that what we're doing is just completely interchangeable. You can do this.
It's not.
15 reps of this, 10 reps of that. Like it's different. And you said the operative word, chaos and variance, right? Because the way that I'm going to go about things are going to be much more conducive to that than the structural conventional stuff. So, for two things, for those physical therapists who are coming up, you will have so much more impressionability and value from a strength and conditioning perspective if I know that you understand what training is.
Mm-hmm.
We don't have to get any further than that. That in and of itself is going to give me much more incentive to listen to you. So what would that look like from the perspective of your end for an S&C person? How can we better understand the nature of physical therapy and what it is that you all do?
I would say that, understand that the efficacy of the athlete and the athlete being ready to really do what they do, because at the end of the day, you want them back as fast as you can. I know I've already said this before, but being comfortable with understanding the physiological response times to heal certain things, because at the end of the day, your hands, what you do, your exercise selections are going to give the advantage for healing to happen, but not in a sense of cutting someone down 6 months to return to play. There's a big difference in, like, time does heal all wounds, right? There's a fact of the matter that they went in there, they were using construction tools on their leg to do what they did, right? So those things have to heal. Bone screws have to set. Things like that. So in other
words, you're not magicians.
Yeah,
you can't just fix it.
Yeah, and I wish I could, but at the same time, that's being able to understand the actual slower process and being comfortable with it and understand it's a total different sector of what we do. I always try to harp on all the strength and conditioning coaches I'm around is like, I have a CSCS, but I can't coach like you coach.
Sure.
Like, coaching is a skill, it's an art that, if you're not doing it every day, you're not adequate. You're not at the same level as that person. And I see it every single day. Hey, can I go out and lead a couple of people through some exercise? Can I lead them through a rehab session? 100% at a very high level. But I can't coach a group.
Right.
Ain't no way. But, the strength and conditioning coaches, they can. That's what they thrive in. So I guess it would be just an understanding of the physiological principles that are behind, say, surgeries or injury rates, or which you're well versed in it. You're a different breed of strength and conditioning coach for sure. But being comfortable with it and understanding that you can't make it accelerate at a hyper speed or anything like that. But yeah,
there's an adaptation timeline, no different than there's an adaptation timeline for improving a 40, improving a vertical. It's the same exact thing. So again, and we know this, we superficially understand that what you're doing is an intricate process, what we're doing is an intricate process. But I think where it starts to kind of get lost in translation is it becomes transactional.
Mm-hmm.
Where it's like, hey, you have a fucking job. Get your job done so that you can get them to me so I can do my job. And that is such a poor way of approaching it.
Yeah.
Because at the end of the day, I mean, everybody is some level of injured. If you're a professional athlete, you're injured.
Yeah.
If you're a military operator, you're injured. What level or degree of injury are we actually seeing at this moment? So that is going to determine the capacity or the amount of time spent on your side versus my side. But it's this constant ebb and flow back and forth. And I think that's really what you and I specifically are really trying to do, is figure out how to create better harmony between sides. And there's just a much more, I hate the word streamlined, but seamless process of like, get some treatment when you need it, get some strength when you need it. And then you'll understand that it's just kind of an always thing. If I had the funds to do so, I'd get a chiropractic, I'd get a massage, I'd get dry needled, I'd have a trainer, I'd have I would love to be able to do all those things. So I think in an optimal setting, you do need all of these inputs. And we started this with specifically speaking of return to play, where there's a much more measurable aspect to it. But at the end of the day, even if you're perfectly healthy, get treatment, get dry needled, get into the contrast baths, do all of the restoration, even when you don't have the signal prompting you that you quote unquote need it. You need to train regularly, just as you need to repair your body regularly. Those are things that are just in constant motion. And I think that we're going to continue to try to put a dent in that.
Oh yeah.
You know?
For sure.